Welcome to this episode of the Montpelier Happy Hour here on WVEW LP Brattleboro 107.7 FM, your community radio station. I am your host, Olga Peters, and I have with me on the show today regular contributor, Representative Emilie, who is one of 3 representatives to the state for the town of Brattleboro, as well as Mike Fisher, who is the Vermont Chief Healthcare Advocate with Vermont Legal Aid. And welcome, Mike. I think just saying your title alone tells people that we have a lot of meaty things to talk about, because healthcare in Vermont is no small issue, especially during a pandemic. So glad you can be joining us today.
It's great to be here. I'm looking forward to having a conversation about just what's going on here in Vermont today.
Well, I would love to start with just a quick summary of your office, because I think a lot of people don't realize the breadth of what the Healthcare Advocate's Office does, because to me, it seems like it helps with people if they are experiencing a healthcare emergency and need an advocate. But there's also a number of informational materials on your website as well that can help people learn more about like healthcare and their taxes, or healthcare and other needs they may have.
So first off, I'm a position and an office that's defined in state statute. And then the state put the contract out to bid, and Vermont Legal Aid has had that contract since the late 90s when it was first formed. So we have 2 sort of major overarching responsibilities. One of them is individual advocacy, and that is for Vermonters who are experiencing some kind of challenge getting the care they need. Often that's a conflict with their insurance company or Medicaid about whether it's going to cover what the kind of care they need. Sometimes it's a conflict with the state around eligibility for state programs or the federal government for Medicare. Often people are just tied up in the bureaucratic mess that happens between their insurance company and their provider when they're trying to get the care they need. And so people call us, and I'm going to make the plug. They call us at our phone number, 800-917-7787. And I have this team of incredibly passionate advocates who are on the phone, available, in pretty much now. They go to work advocating for people who call us with the really complex problems that happen in everyday lives, and people are trying to get care.
And I spend, a decent amount of time referring constituents to various services around the state. And I describe your office as magic makers. Like, it's just, problems seem to disappear once I don't want to overpromise, but it's really like, it's remarkable how good the work is that your office does, because like, just to cut right to the chase within large bureaucratic systems, but also communicate very effectively to the folks who are trying to understand what's happening to them. And that's being able to do both of those things simultaneously, I think, is a rare opportunity within our state.
If you bump into a problem, I'll just like a stupid bureaucratic problem, like maybe your birth date is listed differently with your insurance company than with your provider. It can be really challenging to get your right birth date. And so because we deal with these kinds of problems every day, we know the tricks of the trade. That's not to say that it's not uncommon that people call us and say, hey, I need this care and I can't get covered for it, and it's unfair. And unfortunately, the response too often is for us to say, you're right, it's not fair. That's the rules of the insurance product that you have, or Medicaid policies, and the care is not available to you, or the care is going to be out of range of expensive for you. It's really common that people call us and say, I just can't afford it. My plan gives me an out-of-pocket expense and the care that I need, it just puts it out of range and I don't know what to do. And those are heartbreaking calls. Those are heartbreaking calls.
Can I ask, do you have a way of sort of saving all of those stories and problems and then doing something with the sum of the challenges?
Yeah, so we are into data and record and code every single call in a, of course, a de-identified way, and produce a report every quarter about all the different issues. And I'll just say generally about 25% of our calls are about eligibility. And then we also attempt to, the other half of our shop, maybe this is a good opportunity to shift a little bit. The other half of our shop is about sort of more systemic advocacy, representing Vermonters before the Green Mountain Care Board when they do something like an insurance rate review, which, by the way, the Green Mountain Care Board is doing insurance rate reviews for the Vermont Health Connect plans right now, or when the Green Mountain Care Board is thinking about whether a hospital can add a wing, or whether the hospital budget is right, or the Accountable Care Organization, One Care budget. So we sit at the table and do our very best to speak on behalf of Vermonters in all of those proceedings, as well as in front of the legislature, taking sort of the information that we learn from Vermonters and from our studying of the issues, and bringing that as a consumer advocate to the State House to say, here are the changes we really think need to happen.
So what has COVID highlighted for you? You're working with so many private insurance companies, I can imagine, and yet we're in a public health crisis. Has there been conflict? Has it worked smoothly? Like, what's your experience been during COVID?
Well, so the world is turned upside down. I don't think that I can underestimate, I can overstate how much has changed due to the coronavirus. It in many ways has pushed our healthcare system and our other systems in an extreme way. And so, for instance, hospitals make money by providing a whole, all of the care that they provide. And in the middle of a pandemic, when they really had to reorient themselves to providing this special care, and reducing all of the elective surgeries and elective procedures that they were doing, because the provider system responded to the pandemic, they were put in financial stress, worse than financial stress. The hospitals reported that they were losing $100 million a month across the hospital system during the worst of the pandemic. So because they were responding to the public health emergency, the financing system didn't work for providers.
Wow.
And by the same token, that same reduction in care meant that the payers were paying out less claims.
The payers meaning the insurance companies, not the individuals.
Yes. Yes. So that's sort of just a little glimpse at sort of how our regular financing system got turned on its head because there's a healthcare crisis. People ended up, and because we didn't have a New York City experience of tremendous infections here. Thank you very much. We've done a great job, but in part because we've done a great job, we've had this dynamic of tremendous stress on the provider community, and we're in the middle of insurance rate review, and so we're going to be arguing about this in the next couple of weeks. But at least during this time, it's been a pretty good couple of months for the major insurance companies.
This is a little detailed, but elective surgeries are not necessarily like, plastic surgery and nose job, right? Like can you,
It's something
what exactly is it? Like, it's not like elective.
No, you're
Sounds
right.
like
Thank
it's
you.
like you go out for like a fun surgery. I
Yeah,
can't
thank
imagine
you.
that's what it means.
It's something you schedule.
Okay. And so usually is covered by insurance.
Yes.
Great.
Yes.
Yeah.
So it's not like, I've had bad injury and I'm in the emergency department and I need to be treated. It might be the follow-up to that you're going to schedule for the next couple of weeks to get something taken care of. But no, it's not a fun experience.
It's more, I have cancer and I'm scheduling having a body part removed, perhaps.
Sure.
Okay.
Yeah.
Thank you.
So we've talked a lot on this show over the last, well, I have no idea how many months we've been doing. We've been talking about COVID now, but over that
Forever and
period,
ever.
we've had a sort of a consistent theme about the cracks that widen in the system and what we can see when those cracks widen, and how, we can see both sides of the Gulf. We can see into the Gulf more clearly about where the challenges lie, and how those affect Vermonters. And I wondered if you could sort of get a little more explicit about that.
Well, so I think that when the healthcare realm, I think that the legislature jumped quickly and I think very appropriately to loosen some of the pathways to help people get care. And that, for instance, to waive copays for certain types of care, mostly COVID-related care, but also some prescription drug needs, just to open the door wider to make sure that people could have an easier path to getting the care they need. I have a real
did we also expand the eligibility for the exchange, meaning you didn't have to prove it, you didn't have to have as much verification?
Yeah, so we well, let me get to that.
Okay.
Yeah. Yes,
take your time getting there. I'm sorry.
Yeah. Well, the Vermont Health Connect usually has an open enrollment period, and from November 15th to through the end of the year, for a month and a half is when people can buy insurance. Other than and always when people have a change in life where they get married or divorced or have a baby or move or get a new job, those kinds of things, they have a special enrollment period. During this time, the Fed gave us permission, and the state has taken advantage of that to have a COVID-related open enrollment period. So anybody who's uninsured right now and wants to be insured has the opportunity to sign up. I'm going to throw in if they can afford it.
Okay.
I wouldn't want to say you have an option to do something that you just can't fit into your budget.
It's not an option.
Yes.
Yeah.
The other thing that the legislature did was make really important decisions about the flow of the Corona Relief Fund monies, and from my perspective, appropriately recognized the tremendous stress that the provider community was under, and directed a substantial amount of money, over $300 million, to the provider community. The administration has a tremendous task in front of it right now to get those monies out the door. That's a place that I have some concern about, because it's easier said than done. These monies have to be spent before the end of the year, or we lose them. And
I'm really curious about that, because in most of the other categories of the COVID relief funds, we were much more prescriptive with what the sort of sub buckets were. And I know with this $300-something million, while there was conversation about health disparities and adult day programs and EMS and primary care, small primary care providers and hospital systems, we actually just handed a big bucket over to the administration. And so I'm really curious from you where you think that's going to go and where you think it should go.
Well, I advocated for more of it to go to Vermonters.
Yeah.
To Vermonters who were having a hard time getting the health care they needed, because they'd lost tremendous income. It's worth just reminding ourselves Vermont families are under an economic stress that we haven't seen before. An unemployment rate of 12.7% for May. That's 43,700 Vermonters. That's about the size of Windham County, by the way, being unemployed. And while there's been some extra, federal money to support those families during this time, that runs out very soon. And on top of that, some costs have gone up. Costs of food have gone up. Vermont families are under a particular amount of stress at this moment. And I say that sort of in reference to this proposed increase in health insurance costs that presents a tremendous challenge particularly for Vermont families and businesses, by the way, as well as for our health regulator, the Green Mountain Care Board. How do you balance out the costs of providing care with the prescription that the rates be affordable?
Because we know they haven't been affordable for quite a while.
From my perspective, there's a broad swath of Vermont families for whom there are not affordable private health insurance rates.
Yeah, I think a lot of people tend to find that maybe they can afford their premiums, but they can't necessarily afford their prescriptions and the diagnostic tests and the copay and the doctor visits. So you have insurance, but you can't necessarily use it. I think a lot of Vermont families find.
Right, and so that many Vermonters are out there today thinking that they have good insurance because they haven't had to use it. And so they may know on some level that they have a $10,000 or a $15,000 deductible, but they're healthy and they're going about their lives and things are okay. It's not until you're in the worst days of your life because your kiddo has been just diagnosed with something or been in a horrible accident, and when you realize that on top of all of the stress of implied by what I just said, you also don't know how you're going to pay for it.
When the care board has a conversation and the word affordable is part of the conversation, what do they mean by it?
That's a really good question. So the insurers often argue that it's affordable because it is the right rate for the value of the plan. In other words, you're getting what you pay for.
What does that mean?
So by that logic, a Ferrari is affordable.
Okay.
Yeah.
Because it has that value, and we're charging the right value for what it is. Obviously, as a consumer advocate, I consider affordability to be a consumer-facing. Can this bill fit into into Vermont families' budgets? And so when I look at affordability, I have to look at income along with the expenses of food and housing and heat, and to see whether the insurance rates, fit within those families' budgets. That's
other places in our system, when we use the word affordable, such as affordable housing, that has a technical definition that's related to a family's income. But in this case, it's not.
Yes, so you're right. Even the affordable housing, the 1/3 of your budget.
It's
housing. It is a blunt instrument, but at least it is. It recognizes the family's budget when you use the word affordable.
We have just about 5 minutes before we need to go to break. So this is all a wonderful conversation. But Mike, what do you want, just before we go to break, what do you want to leave people with as far as where healthcare is in Vermont right now?
So just because we've just been talking about this term affordability and insurance rates, the Green Mountain Care Board is required to take comments from Vermonters. And so this year, Blue Cross is asking for a 6.3% rate increase. and MVP is asking for a 7.3% rate increase. And I really think it's important for Vermonters to tell the Green Mountain Care Board about the affordability challenges that they have in getting care. There's nothing like 500 stories coming to them about just putting it in the context of what families' lives are really like. So I think, people can go directly to the Green Mountain Care Board webpage. We also have provided sort of comment links to help people get to it. I'm hopeful that we can get those links up on both Emilie's Facebook page, where should people look for those links?
So if you could name the link, if you could sort of say the URL, and then we will ask BCTV to put it up here. Scrolling across right now. Thank you, BCTV, for that technical assistance. And I'll make sure to add it in a comment anywhere that we post this on social media, whether that's Instagram or Facebook or.
Yeah, so we have a link that's called submit a public comment. It's a www.bit.ly/submit a public comment.
Okay.
And I also want to say that it's not hard if people don't have a pen and they, are just not taking notes or anything. It's not hard to go to the Green Mountain Care Board webpage. If you search for Green Mountain Care Board Vermont, submit a public comment is pretty prominent on their page as well.
Great, thanks.
Fantastic. And when's the deadline for submitting comments?
Oh, that's a good question.
I find that often when we give people deadlines that are more than a few days in advance, they put things off and don't do them. I know that's true for me. So let's just say that the deadline is 2 days from when you hear us say this.
Yes, it's really, the sooner the better is the right answer. I agree, Emilie. The hearings are the 20th and the 21st, so just a week and a half away, and the comment period ends pretty close to there.
Thank you. If you're just tuning in, this is the Montpelier Happy Hour here on WVEW LP Brattleboro 107.7 FM, your community radio station. I'm your host, Olga Peters, and Representative Emilie Kornheiser and Mike Fisher, the Vermont Chief Healthcare Advocate. We will all return after the break, so stay tuned. Hello and welcome back to the second half of the Montpelier Happy Hour here on WVEW LP Brattleboro 107.7 FM, your community radio station. I'm your host, Olga Peters, and if you are just joining us, I'm speaking with Representative Emilie Kornheiser, who is one of 3 representatives for the town of Brattleboro to the State House, as well as Mike Fisher, who is Vermont's Chief Healthcare Advocate with Vermont Legal Aid. And we are talking, as you can guess, healthcare and COVID. And where is all the money that we just got for the COVID relief funds from the federal government with healthcare? Where is that going? I think I heard a rumor that there's like $300 million, which sounds like a lot, but when it comes to healthcare, it goes really fast.
So yes, a substantial amount of money got appropriated by the legislature to be put out in grants to Vermont healthcare providers to provide relief for the lost income that Vermont providers have experienced. And imagine you're a dentist and you suddenly have to close up shop. How do you make it through this time? And so I think that, I just sort of played my hand a little bit. I think that there are some very large healthcare institutions in our state, UVM in particular, but all of the hospitals that we absolutely need to make sure make it through this crisis, that they're financially viable. But we also have hundreds and hundreds of small providers and they might be dentists, and they might be primary care docs, and they might be many other types of providers who are particularly exposed. They're small businesses, and they don't have an association working for them in the same way in the State House. And so,
and it's, just to make sure that people, I don't know if everyone loves their dentist as much as I love my dentist. And so want to make sure that people understand that we can't spare any dentists or primary care doctors in this state. We have a pretty serious both dental and primary care doctor shortage. And so losing just one means that there will be a lot of people who are already struggling to find a provider who have even less of a chance of finding a provider.
Yeah, to that point, before the COVID crisis, we have all been very, very worried about the age of our workforce in many of these fields, and the numbers of people, of dentists and of primary care docs and nurses who are who are ready to retire, and the flow of doctors coming into of providers to come into to fill those positions. So you put COVID on top of that, and I think many of us have a real concern that there won't be a provider network, as good a provider network, if we don't really make sure that they are rescued financially.
Interesting.
So when you ask where's the money going to go to, we've asked the administration, the legislature asked the administration to create a application process for providers to apply to. My understanding is that it's in the next couple of days that's going to be opened up. It's imminent. And I'm going to be watching that flow of money, particularly around making sure, with the value of making sure that it's going somewhat proportionally to the various types of providers that there are out there. It's not enough money. We just said, I said earlier that the hospital systems lost something in the range of $100 million a month. We've been at this for 4 months. That's just the hospitals. Hospitals represent, 35 or 40% of our healthcare system. There's a lot of healthcare that happens outside of hospitals. So there's just a bit of an expression of how much more need there is than the monies that the federal government made available to the state.
And then in terms of the hospital systems and rural healthcare and our small hospitals versus our big hospital systems, how does that play out when, if people are thinking about Brattleboro Memorial Hospital or Springfield Hospital down here, how will this affect what I've understood as sort of an increasing consolidation in hospital systems?
Yeah, it's a good question. I think, the pattern has been for hospitals to consolidate. You guys live in a community where the challenges of hospital financing has been acute, again, before the COVID virus. And so I don't know exactly what to say other than I think you've just spoken to a real concern.
Okay.
Is this going to push more independent providers and more small hospitals to become part of larger systems? It might. And while I have a personal value that is counter to that, I get it. You got to survive. And the economic pressures of today might force the hands of many providers.
We've already had one primary care practice in our community close/join the hospital system in the last month or two. Yeah.
And some of that has to do with providers that want a paycheck.
Yeah.
That they want a dependable income. And, again, I certainly understand those pressures.
I absolutely do too.
So given that we have a limited pot of money to support the healthcare system post-COVID, or still actually kind of during COVID, let's face it.
Well, let's talk about that for a minute. We are in this pandemic. We are in this healthcare crisis for a long haul. You know, sort of recent discussion. I've had recent discussions with Vermont, major hospitals to understand sort of the flow of money and patients. Are people getting access to the care they need? And while there's been some real improvements in the last couple of weeks of people getting into to get the procedures, to get the care they need, there's also a lot of Vermonters who, rightly or not, made the decision that they just don't feel safe going in to get the care that their providers have recommended.
Mm-hmm.
And so we're still in it,
Mm-hmm.
and we're going to be in it for some time. Let me put it that way. There's no sort of imminent change coming at us, particularly given what's happening around the country.
Well, that's kind of what I'm having a hard time getting my head around. Excuse me.
Mm-hmm.
Is, we have this big need. We have this influx of money, and yet this money seems not enough to meet the need.
Mm-hmm.
And it needs to be spent by the end of the year. So is this helping, or should we be doing something different with this money? Like, what's the best way forward so we have resilience and not just survival?
Can I add to that question? One thing that came up very early on in the pandemic is all of the providers around the state that provide fee-for-service. And that in these times, often people need to reduce the services they're providing because they can't provide in-person services, or the fee-for-service is you receive less funding if you're doing something virtually rather than in-person services. And so some of that sort of, we put some attention to restructuring those systems in order to keep those providers still viable. But I'm curious, as sort of part of your answer, what else we could do in terms of restructuring.
Well, so let's talk about telemedicine for just a second. Telemedicine took a giant step forward in the middle of this pandemic, and that's, I think, been an important tool for providers and for Vermont consumers to be able to get to the doctor. But sort of the question before us, and the legislature made some decisions about the flow of monies for those visits during this time, as well as the federal government made some decisions around sort of opening this flow of traffic up. So all good stuff in the middle of a pandemic. As a healthcare advocate who is focused on quality, I know that people get better in relationship with their providers. And I am sure that people can have people who have good relationships with their providers can receive good care over a telemedicine interface. I also, this is my own personal value, I also believe in-person contact is important. Yeah. And so I get worried that we're moving into a world where people will no longer see their doctor. And I'm talking post-pandemic, I'm talking years out. There's this image that gets evoked for me of a little kiosk that sits on the street, and you're visiting with your doctor who's in Milwaukee or something, I don't know. And that's just not the image of ongoing care that I think is curative, is what helps people be better.
No, but there's a real financial incentive towards that.
Yeah.
For the insurance companies.
Yeah. But having expressed that concern, telemedicine is a really important tool, probably at all times, but particularly right now, to both from the consumer side and from the provider side, as long as there's choice.
You said something. Sorry, Olga.
Oh no, go ahead.
Something earlier on about the idea of us providing needing to provide a public health response
Mm,
within a private healthcare system.
yeah.
And
So
when I think
let's
about
talk about,
widening cracks, that seems like the
yeah,
widest of the
yeah.
cracks here.
So let's talk about testing for a minute. So today, our public health agency, the Vermont Department of Health, is doing an incredible amount of work, an incredible job of both doing the contact tracing, key to us doing our best to not have a new widespread spread of the virus here, as well as providing for testing for people who don't have symptoms and who don't have a doctor's recommendation that they get tested. And so that's a public health response. We have real concerns about whether that can be maintained. And as we consider doing things like opening up schools to in-person schooling, let alone all the offices and all the other, opening that I think needs to come and will come, a vibrant, available testing opportunity needs to be there. It has to be a part of what keeps us safe, and we need a system to do that. It's a public health need, and it's not reasonable to say, oh, the Department of Health is doing it and it can do it. And when you ask the healthcare system, like let's say we say, okay, Brattleboro Memorial Hospital or Springfield or UVM for that matter, we want you to make testing available to anybody who asks for it. You have dynamics where you have employers who say, hey, I want you to be tested every few weeks, or that kind of thing. And there's no doctor saying it's a different kind of healthcare. I mean, it's a public healthcare, not an individual healthcare. And so, should insurance rates cover the cost of those tests? These are tough questions, and that's before there's a vaccine. Hopefully, we're going to have a vaccine, and hopefully it's going to be something. Hopefully, we're going to have a vaccine. We're going to need to get it out to everyone. Who should pay for that?
Yeah.
I would argue that's a public health need. It's just as important for me that you get it as it is that I get it. We all need to get it, and so that's a big public financing challenge. Honestly, we don't have a mechanism to do that. We don't know exactly how to do that.
And other vaccines are available at the Department of Health free of charge, but most people go through their doctors and their insurance gets billed for it.
Well, Vermont has an interesting public financing for vaccines. And I think we're an anomaly. I don't know of another state that does this, but we bulk purchase vaccines today. I'm not talking about COVID. I'm talking about flu and childhood immunizations. And we finance that with various taxing mechanisms, and then that gets delivered, at the drugstore or at your primary care doc or pediatrician. So that may be a model for vaccines. A little bit simpler than testing.
It's interesting. In my office, as we are drafting reopening guidance, as sort of once we're really doing a lot of client contact, want to recommend that staff get tested every 2 weeks.
Yeah.
And so we're sitting with, well, we certainly can't ask staff to pay for that. That would be ridiculous. And so we send them, here's the Department of Health. They're coming once a week with the pop-up site. Can you sign up far enough in advance? As many more employers are sort of going through that portal, it's already filling up long before we hit the Wednesday. And so absolutely, I agree. It's very complicated. And what I found also is that a lot of Vermonters don't seem to know that's even available and are going to urgent care and paying for the test. And then there's this mix of different tests that people are receiving, and they don't seem to have consistent results.
Yeah.
Yeah.
You know, another
West.
public health angle, we were talking about independent providers not long ago, and the financial pressures on them. My understanding, and I don't know enough about this, but my understanding is that the purchasing of masks and other protective equipment for the hospital system is done on a higher level. I think UVM plays a key role in that. But if you're an independent dentist, you're out there bidding against every other dentist and primary care independent provider out there to buy your masks and equipment.
And that's every provider in the country, right? It's not
Yeah.
just you're bidding against other Vermonters.
Yeah.
Okay.
And so that's been a real stressor, I believe, for providers. And my understanding is that the state has taken a step forward in doing a bulk purchasing of PPE equipment for broader providers. So that's again, it's an example of a broad-based answer, a public health-like response instead of leaving everybody out for themselves.
So when I think about Vermont and public health and leaving everyone out for themselves, I think about the promise of single payer. And I know that you were used to be in the House of Representatives and were vice chair and chair of the healthcare committee through that time. And so I'm curious, when you think about the difference between then and now, I certainly have my own ideas on this and the increased cost of healthcare and perhaps public will around all of those things. I'm curious about, how would things be different if we had actually realized the promise of single payer? What opportunities are available to us now?
Yeah.
Wide open.
Well, I think the first thing to do is to phrase it in the context of the virus. We need a healthcare financing system that can provide care for Vermonters during a public health emergency. And that's not harmed, that's designed to work for Vermonters and for Vermont, and that means for Vermont providers too. There's been this, some people have expressed, well, the all-payer model, run through one care. One aspect of it, a key aspect of it, is prospective payments. In other words, we're going to give your provider a certain amount of money. That's on average what it costs to care for you. And there's this whole risk aspect of that to change the incentives for the provider, but let's not focus on that for a second. Just the prospective payment part. Those prospective payments were really valuable to providers during the pandemic. My response is that's not enough. If we want providers to be able to provide the care that's important for the community, we need to do something more like global budgets for them. In other words, this is what it costs to run Brattleboro Memorial Hospital, given the needs of the people in the community. And we're going to measure you and test you and hold your feet to the fire for quality more than they want to be, from my perspective. But we all know that everybody in Brattleboro, people need a place to deliver babies. People need a place to go when they have cut their finger real bad. So
people need a place to go when they've overdosed.
Yes. People need a place to go when they need whatever the care is that they need. And if we want a provider system to be vibrant and continue through a crisis like this, I really think, and I've always felt, honestly, that we need to move to that kind of a financing system. Now, I didn't say a word about how we collect the money in that description, just about how we dole it out to the providers on our behalf. But that's really how we collect the money is where we fell down last time. And I think that there are many. We fell down last time with the Obama administration, and and with Governor Shumlin, previous governor, and so I can't help but say, wow, we need a different kind of partnership on the federal level in particular, in order to be able to even entertain doing this. There's nothing simple about it. It's a very complex flow of money the concept of single payer is a misnomer. There's nothing single about it, but especially for a state doing it on its own. But the need is tremendous, and again, going back to the baseline pressure on Vermont families. I don't have a doubt in the world. I know from story after story that many Vermonters don't get preventative and ongoing maintenance care, care for chronic conditions because they can't afford it.
And I think
that results in worse outcomes and higher expenses.
Yes. And definitely another theme that I think we've woven through most of the episodes that we've had lately is that spending money earlier on in a challenge is often less expensive as well as better for everyone. I think it's also worth naming that between when we first started a conversation about single payer, universal healthcare, whatever we want to call it in Vermont, and now individuals and businesses are spending significantly more money than they were then. And so when we think about funding mechanisms, I have some hope that there's more individual will towards that, or perhaps even a greater willingness around people's budgets because of how much is already going out of pocket from each Vermonter compared to even 5 years ago.
The challenge, Emily, is that if, these are numbers from a couple of years ago.
Yeah.
But if we say, okay, we need an 11.5% payroll tax to finance this, many businesses hear that and say, wow, that's a great deal. I'm paying way more than that today. And many businesses hear that and say, you've put me out of business because I'm not paying anything for it today. And so there's the rub. There
is the rub. And it's the rub of being in a state that's filled with micro businesses, not even small businesses, who really don't have the capacity to provide benefits to their employees. But that's the sort of economic system that we have constructed here. And in some ways really, pride ourselves on.
Yeah.
We are just about out of time. So any last minute thoughts you want to leave the listeners with, Mike?
So I want to fold back to the very first thing I said. We've been talking a lot about theory and about where we should be going, and I just want to remember that I know that there are listeners who are facing challenges today, and may need some support, an advocate to help them get through whatever it is that's challenging them today. Be it figuring out what kind of health insurance to buy, or how to afford the care they need. And so I just want to say again out loud the Healthcare Advocates helpline number, and to let you know that we're here to support you. And that's 800-917-7787. And my advocates are always psyched to make things work if they can on behalf of Vermonters. So
thank you.
Feel free to give us a call.
And Emilie, where can folks reach out to you if they have questions or concerns?
EmilieKornheiser.org, eKornheiser@gmail.com, eKornheiser@ledge.state.vt.us. You can find me on Facebook and Twitter and Instagram, and I hope someday soon to be able to run into you on the sidewalk the way I used to.
Thank you, Emilie Kornheiser. Thank you, Mike Fisher. Thank you, listeners. The Montpelier Happy Hour will be back next week at 2 p.m. on WVEW LP Brattleboro 107.7 FM. In the meantime, you can always find us on BCTV, Emilie's YouTube channel, or our Vermontitude SoundCloud page, or our Vermontitude Facebook page. Have a great weekend, everyone.